call Christopher Ehimen of Nett Pharmacy and Dr. Adewara of Mobihealth International, Dr. Funmi Adewara of Mobihealth. I also have Abiodun Akinpelu of Rigo. Love this. Okay. Good afternoon again. I see all my panelists here. Like I mentioned, very solid and strong voices within the industry. Hello, ma'am. I am going to go right into my first question. And just as a brief introduction of Dr. Christopher Ehimen of Nett Pharmacy, he has built and scaled a pharmacy business in this exact Nigerian economy. And he kind of brings the operator's view on how you actually fund and manage a healthcare business on a day-to-day. So, Dr. Chris, good afternoon. My first question to you would be, many pharmacies and healthcare businesses, are very profitable on paper, but they still struggle with cash flow. In your own experience and looking through your journey with Nett Pharmacy, what is a financial habit or a business decision that you've made that has made a big difference in your long-term operation of your pharmacy?
Good afternoon, distinguished colleagues. First of all, I want to thank Rigo. Formerly V Plus Eyes. Okay. I also want to thank other people paying your space. The fintechs and corridors who are providing quick loans to a lot of community services. But for people like this, I'm sure a lot of us will have faced a lot of financial struggle. So I want to thank you on behalf of everybody present for providing the finances that help us to do business and scale our business. If we were to depend on the traditional banks, I'm sure a lot of us would have suffered a lot. So thank you very much. Now back to the question. The question is talking about those financial habits that I've lacked over the period that help us to have a sustainable business. And the fact that, yes, your community pharmacy may be profitable, but you still struggle financially. Okay. What I've learned over the years is that, yes, you make profits, but profits is an opinion. It's an account record. It's at the end of the day, when your external auditors come and an auditor goes, it's okay, these are profits. But what's most important for a business, a community pharmacy, most importantly, is your working capital, is your cash flow. Cash flow is the lifeblood of any retail business. Cash flow, without cash flow, your business is not likely to survive. Yes, you can make profits, but if you don't have a cash flow, you are likely to struggle a lot. Over the years, I run a chain of pharmacy. At the end of the period, they say, okay, you wait profits, but we struggle. I'm sure a lot of us are in that space. We struggle to pay our suppliers. You know why? Because that cash you think to have is locked up in inventory. You don't have it. You just don't have it. So what we say is that yes, you might be profitable at the end of the day when there's an accounting is done, but you don't have the cash to run business. And so what's important for us as community pharmacy is that we must know how to manage our cash flow, how to manage our working capital. And managing working capital or cash flow involves a lot of things. I'm sure over this period you'll be there, people have talked about how you convert inventory to cash, the cash conversion cycle, how you manage your suppliers' credits, how you manage your inventory, how you manage suppliers' credits. The important thing for any retail business is how quick can I convert my inventory to cash? Do you see that? Whether you make profit or not will come at the end of a period, maybe a quarter, a year. But if you don't have cash right now, your business cannot survive. Let me give you an experience. I have a lot of friends who play in the grocery business, big ones, grocery business. Now, I have this friend who had a very big grocery chain, sells all kinds of things. And what they were discussing, he told me every time I struggle to pay my suppliers, if I take valuation of my inventory, run it into billions, but I don't have the cash to pay my suppliers. Then he has another friend who is into restaurant business. That one for him, when you say you don't have cash, you look at you, I think you don't know what you're talking about because he's legal, he has the cash. And he then said, okay, let me do something. Instead of using the whole of my store for groceries, whereby anytime I come in the morning, I just look at the whole stock. My money, cash is there, but I don't have the physical cash. Let me see if I can use part of this my store for restaurant business. So he started. In the restaurant business, they will buy maybe a sack of rice, a sack of beans, or whatever in the morning, convert it to food. In the evening, everything is sold, and he's getting all this cash. You understand that? He's getting all this cash. Now, what he's doing now is dividing his stores into equal half. One part for the grocery, one part for the restaurant, because he discovered that the restaurant is bringing in more cash than his grocery business. So what we are basically saying here is, one of the things I've learned over this period is that profit is important, but cash flow is more important than your profits. And if you are in retail business, you must have your cash flow projections. If you are in the stage that in the next 6 months, to the next 1 year, I'm going to run out of cash, start planning for the cash right now. Because it takes time to get the cash. You know, quite often we are told there's money everywhere, you can get money everywhere, but is there being money everywhere? Maybe there's money everywhere, but getting that money can be very difficult. Maybe thanks to Rigo and Co, who make things a little bit easy. So what we advise, and one of the lessons I want, that yes, it's good to make profit, your business will be profitable, but what you need to take care of, most importantly, is your cash flow. You must make sure your cash flow is working for you. You must manage your working capital. You must turn your inventory into cash as quickly as you can. No fancy, no tricks, nothing, but turn your inventory into cash as much as you can. Because once you're able to do that, you're able to sustain the business. It's not so much about profit. If you manage your cash flow very well, you are likely to make profits. But cash flow is very, very important. As one as here, banks over this period.
Dr. Funmi Adewara is the founder and CEO of Mobihealth International. She has a very long and rich pharmaceutical industry background, and she has also built technology-enabled healthcare company that now reaches patients across multiple markets in Africa. She has raised internationally, and she brings the view for growth by network and mostly expansion. So from your point of view, when it comes to raising money, getting funding, and financing, and how it brings more, scope for expansion and businesses, my question really is, in the healthcare number that you've built and that you currently operate, what financial decisions which you're raising has given you the large scale, and how did you make it work?
Okay, thank you very much, and thank you, Rigo, for inviting me to be part of this very important discussion. Ladies and gentlemen, good afternoon. I'm a doctor, a medical doctor. So you can imagine how uncomfortable it felt to be in this atmosphere where you're talking down on my colleagues. But on a more serious note, I dream of a future where we can actually really work collaboratively together. And instead of, finding this professional rivalry between doctors and nurses, between doctors and pharmacists, between doctors and other healthcare professionals, and this is not blaming anybody because it's the same on the other side. I really dream of a future where we can really come together collaboratively for the sake of our common mission, which is the patient. There is no single healthcare professional or professional group that can solve healthcare problems on their own. We all bring different expertise, professionalism. And as I sat down there, I was talking to my brother and I said, are we saying that as educated, as experienced as we are, we can't really come together as professionals and table all these differences on the table and reach an amicable resolution. In the UK, they're now leveraging pharmacies to provide clinical care. Nigeria does not have enough doctors. So there is no way any single profession is going to be able to work alone. And I think that we need to start talking from that perspective. And this applies to nurses, doctors, not just pharmacists. So please, we need to think more collaboratively, because the future of healthcare is going to be driven by technology, collaboration, and it has to be patient-centered. I just thought I dropped this line. Thank you. So I'm leading a multi-million-dollar digital health transformation across Africa called Mobihealth, supported by Afrexim Bank. And I'll say that there's been a lot of misconception around funding, financing. Most people believe that you need money, you need to raise to be successful, to grow, to scale. That is partly true. But we see quite a number of organizations raise a lot of capital and they busted. So I think it's about disciplined financial management, disciplined financial execution and allocation that helps us to scale. I've been listening here all day and I hardly heard anything much spoken about leveraging digital health to scale your pharmacy business. Pharmacies are going to be central to the next level of healthcare delivery globally, and we are seeing it play out. You're the quickest access to doctors. You're the quickest access to healthcare in a community. 80% of Nigerians come first to the pharmacies before they think about going to the hospital. And we've heard quite a number of discussion around preventive health. We've heard about how to leverage other multiple revenue streams rather than just focusing on medicine dispensary. Pharmacies can serve as a cost point of contact for chronic disease management, screening, nutraceuticals, and everything in between it. So for us at Mobihealth, when I started, I wasn't focusing on, of course, access is a problem, but I wasn't focusing on, can I open more hospitals? Do we know the difference between growth and scale? Does anybody know the difference between growth and scale? Can anybody tell me, please? Okay, in the interest of time, growth is you opening multiple pharmacy centers, chain of pharmacies. Your growth, you may have money, you open many pharmacy chain, and then your cost increases linearly. Scale is you not opening more centers, or you being able to reach more patients, but your cost is not increasing exponentially. And how can you do that? You are in one location. Are you doing e-pharmacy? Are you able to dispense medication to patients in Maiduguri even though you're in Lagos? That is going to give you scale. And so that is, as Mobihealth, we started off investing in digital infrastructure, technology. So we reckon that patients need access. They live far away from hospitals. It's not about building more hospitals. More than 60% of medical problems to 80% can be handled at primary health care. Pharmacies are primary health care providers. So we partnered with pharmacies to be where partnership in MedPlus, as an example, they had 160 stores across multiple states. So we partnered with them. We're saying patients go to pharmacies first. Okay, we meet them where they are. And that was how we were able to leverage on that. So it's important that we leverage digital health tools. And that now goes to the question, how many of us in this room are leveraging digital health, telemedicine, e-prescription, e-pharmacy, diagnostics, sending prescriptions to the patient at home and monitoring them remotely, connecting them to specialists when it is beyond the care that you can give in your pharmacy. I think that's what we need to look at when we're looking at scale. Collaboration gives you scale without, again, increasing the cost. Why do I need to go build digital health hubs when I have you? So how do I partner with you in a way that there's revenue share that allows everybody to benefit from it? So as a pharmacist, you know that patient coming to the pharmacy, I have headache, it must be malaria, no testing, they prescribe. I have this cough, it must be pneumonia, give me a cough, I need antibiotics, you prescribe. You probably are underdiagnosing or misdiagnosing. In some instances, the patients are misdiagnosing or diagnosing. But when you have telehealth in your pharmacy, then you can tell them, scan the code, you know you can see a doctor here. Or if it is within what you as a pharmacist can provide, that is fine. But how many patients can you single-handedly see in your walking pharmacy? Versus if you launch telehealth as part of your product, and in partner with organizations like Mobihealth, we have over 20,000 doctors, nurses, pharmacists on the platform. And then that means that with you providing telehealth, you're not necessarily just providing services to patients within Ikeja, Isolo, or be your location. It means that through your platform, a patient can be consulting with pharmacists or doctors or nurses on the platform, and you are making revenue from it. You are able to dispense the medication to them at their place of choice. But importantly, you don't need to invest in the digital infrastructure, building telemedicine platform. Why do you need to do that? You have a partner that you can work with. Your sign up is almost instantly or within 24 hours. You join the network. You can upsell. So if the subscription plan is 2,500 naira per consultation, you live in an area where a patient can pay 10,000, then you can upsell it. So this is how you can get on board by looking at how do I collaborate with others there. For instance, what we did was to partner with pharmacists. So we onboard them on the platform. It's both ways. We refer patients to you for prescription. That increases your footfall beyond the physical footfall to digital. Then we also, you refer patient to us. So you're telling your patient, now we are telemedicine. You don't need to go to hospital anytime you're sick. It is far more convenient, more affordable. So come on board. So they come in. We kind of white label it. If you go on Medicals, you will see Medicals telemedicine portal. It's powered by Mobihealth, right? So they have access to thousands of doctors. So the clinical issue you're trying to circumvent is taken care of already. And then you are increasing patient footfall. You are able to upsell it, diversifying your revenue stream. Because again, he spoke about cash flow, right? So diversify your revenue stream to add more and grow. So I think I'm happy to talk more, but I don't want to take too much time.
Thank you so much, Nolas. It's all nice and good when you have ideas, when you have, workflows that you want to try out, but without the finance that helps you move things along. Some pharmacies do struggle, right? And I think that's where Rigo as a company, comes into the picture. Abiodun Akinpelu is there, everyone's at Rigo. They are a healthcare finance company that has financed thousands of pharmacies, clinics, and hospitals around Nigeria. Where we see all the cash flow up from our personal businesses, they see data from multiple businesses and see where the financial footfall or pitfall is. Abiodun, in your years of working in healthcare financing, what are signs, and this is again masterclass, what are the signs you will see from a pharmacist book and see that in the next 2 years you probably struggle, or what are signs that you see, I'm like, you know what, you are ripe for funding and we can fund your business?
Thank you very much. Distinguished pharmacists in the house. Rigo Microfinance Bank is an healthcare bank built for healthcare businesses strictly. So which means that our focus and our goal is to empower healthcare businesses to scale, and by providing financial solutions that does not only improve your working capital, but also improves efficiency and lead to scale. So over the years, having partnered with over 2,000 healthcare businesses, one thing we've noticed is that successful pharmacies are rarely the biggest pharmacies. They are actually the most disseminated. So, a lot of people confuse success in pharmacy business for large shop or pharmacies with the largest inventory or being in the best location. Well, while all of these are important factors, however, we see that they are not actually what predicts sustainable growth. So what we've noticed over the years is that pharmacies that continue to grow consistently and repay their credit facilities with us have about four things in common. And the first is that they know their numbers. So in this case, if you meet a pharmacy owner now, he should be able to tell you off the top of his head what his monthly sales is, what his gross margin is. It should be able to tell you what products are the fast-moving products, the slow-moving products. All of this information is what now helps those pharmacy businesses to make more informed decisions based on facts rather than making decisions based on mere assumptions. Right. Another trait that we've seen in pharmacies that continue to scale and continue to be in successful business is the fact that they separate their personal income or personal cash flow from business cash flow. So these pharmacies, they understand that revenue is different from profits. So in essence, we've seen cases where a lot of pharmacies make a common mistake of treating their business accounts like personal wallets. So what they do is after every week of good sales, they feel like, oh, we've sold so much this week. And the next thing they do is to withdraw from the business account, not realizing that they are actually meant to withdraw from the profits. They have actually withdrawn from the revenue, which is what they're actually meant to use to restock, right? Are actually meant to use to pay suppliers, are meant to use to repay their credit facilities. So along the line, pharmacies that that actually exhibit this kind of habits struggle along the line. They struggle with stock out. They struggle with not being able to meet up payment to suppliers, not being able to meet up payment to their bankers. And at the end of the day, such pharmacies struggle. So this indication, it was just what differentiates successful pharmacies from the ones that struggle. And another one is pharmacies that continue to grow, they build trust. So building trust has to do with first building trust with your patients, that is the customers. Because customers come to your pharmacy not because you have the biggest shelf, you have the biggest inventory, but because they trust you as the pharmacy. They trust that when they come, you don't sell unreputed products to them. You sell authentic products. So this trust is what leads to repeated businesses. And also trust with suppliers. I mean, when your suppliers gives you products on credit, for example, you pay back on time as and when. This is when they are able to give you more credit supplies in form of spontaneous financing, which now leads to working capital that you use in running your business. Also, trust with your bankers, especially your lenders. When you continue to repay your facilities as and when due, that is when Rigo will know that, okay, this person pays regularly, and then continue to fund your business and fund your operation, and that's how sustainable businesses are built. And finally, we've realized that businesses that continue to scale are those that use finance. They use the finance diligently. So this is what I mean. They do not just borrow money because they are short of cash. They approach the bank for finance because they've seen opportunities to generate more cash than the cost of that finance. So, in essence, if you just approach a bank for financing because you feel you are out of cash, you struggle along the line. But if you realize that, okay, there's an opportunity, maybe you have a supply to meet, you have POs to fund, and then you approach a bank for financing,
you see that the finance cost in this instance now becomes an investment, and you will not struggle at the end of the day. And as Rigo, we realize that financing does not just build successful businesses. Rather, it accelerates businesses that are already built with strong financial discipline. And for us, we are not just, our goal is not just to lend money to you, but to actually partner with healthcare businesses by providing capital for them to, by deploying those capital that we give to them to deploy into different, into their operations, such that they continue to grow sustainably rather than mounting more financial pressure. Because it is very important. If you don't fund strategically, you will now, at the end of the day, that funding now becomes stress on the business. And that's how those businesses do not thrive. Thank you very much.
In just 1 minute, if you have to give advice to someone that is trying to replicate the same, number one, with limited capital, how do you advise them to borrow? Because what we're trying to achieve here is you require funding. There are credit facilities that are going to help you with that. How do you advise them to borrow wisely, spend wisely, and use that operationally?
Okay, in an environment where you have limited capital, right, and we are trying to start off, there are a couple of things you just need to look at. Yes, Nett Pharmacy is 22 years old. We've grown organically, and so if you are coming as a starter, you don't want to, when I talk to some young people coming out of school, they said, you are very successful, I want to be like you. Yes, we want to be like you, but we have like 20, some people have 40 years behind them. You cannot be like me from day one, so you got to start small. So if you have limited capital, right, and you want to start running, you want to open a pharmacy, the first thing I will advise you to do is, yes, you want to start a business, but look at building a sustainable business. And there are a couple of things you got to do. The first thing is, first of all, and we all know this from business schools, you want to open a pharmacy store. Location is very, very, very key. For me, I had a theory in Nett Pharmacy. We have a theory about location and the rent you pay for a location. The theory that the relationship between how much you pay for rent and how much you turn over must match. In most businesses, in most business schools, they tell you your rent should not be more than 5% of your turnover. So I would rather pay 5 million and make it over a turnover of 100 million than pay 50,000 and make a turnover of 500,000, right? So if I want to get a location, I need to be sure that the location I'm getting, the rent I'm paying, will justify the turnover I'm going to get from there. So, but if you have a limited capital you want to start, I would say look for a location where you can, the rent will justify it and how much you are going to sell at the end of the day. I mentioned before that I have a lot of friends who are in the grocery business, who are in the supermarket business, big time. One thing about that, I've studied them, one thing about that with them is when they are choosing the location, the first thing they want to look at is, can I have a parking space that can take 50 cars, 100 cars? They rather have a small shop and space for 50 or 100 cars than have a big shop and there's no space for cars. So location is very key. Sometimes when I walk around town and look at pharmacy, you see a pharmacy shop, immediately in front of the pharmacy shop is a gutter. Then you have the road. Now when you are telling me streets, without even asking you that, people that come to your people that trek to your place, that's what you are telling me. Because you can't expect me to come with my car, park there, and say, hey, or jump over the gutter. No. So location is very key. You must start relativity between how much you pay as rent and how much you are going to turn over. You must bear that in mind. There are a lot of metrics that people can use to determine location. It is very scientific now, but that is a discussion for another day. Another thing I will advise people with limited capital is, please be careful of the stock you invest in when you are just starting off. If you don't have limited capital, right? Because you must remember what I said before. Cash flow. When you are not every time, not when you are starting. Cash flow is sometimes more important than your profits. If you don't have the cash, you can't even make the profits. So you must invest in stock that you can easily turn over, so that you can generate more cash. Don't go and stock everything, put everything in the store and say yes. You know, we pharmacists, we always have this feeling that I want somebody to come here and say, hey, you guys are well stocked, or everything I need this year. Trust me, 1 year down the line, 2 years down the line, some of those stocks are going to expire. So you must identify those stocks that you can easily sell and turn over cash. In my company recently, we asked the system, tell us stuff that we not sold one for the past 1 year. We'll be amazed. Uche is laughing, you'll be amazed. Let me not mention figures, but let me say something. We got almost 200 million worth of drugs, or not drugs now, items. You know, we sell both drugs and everything. Cosmetics and supermarket that we would not sold money for the past 2 years, which is a body. You know, when you have that kind of thing, it's tying down your capital. You're going to struggle, right? The other thing you need to invest in is the good people. If you have limited capital, please look for people. You know, I'm not saying go and put your relations and all that, but have people that can help you. You know, one thing is to have a store, but you also need people to help you to market it. Then technology, from day one, start with technology. Please, start with technology. You know, no matter how rudimentary it is, no matter how small it is, there are some you can buy off the shelf very cheaply. Don't go for the big ones, you know. The big ones that are very expensive. Start with the cheap ones. Then the other thing you must do, which is very, very important, that when you have limited capital or when you are just starting off as a young person, please make sure you have a competitive advantage. You must be able to show some customer experience. Remember, your competitor is already 200 meters away, right? So you must, you know, this is what I tell a lot of young people, right? The young people come and say, oh, Nett Pharmacy, we want to set up like we want to have a store, because it's not necessary. Somewhere you can start with, but go and learn. Don't just come out from school and say, I want to go and open. Community pharmacy, opening a store is not the lowest. People think it's the lowest hanging fruits. But remember, it's not for nothing that, you know, the Igbo system, you have this apprenticeship. Every business you want to enter, there's a body of knowledge. There are tricks out there. So spend some time as a young person learning those tricks, so that when you start your own, you can do something well. But there are a lot of things you must avoid. If you have limited capital, you are just cutting off. You know, no fancy, no trees, no freeze, no gold-plated shelf, and all those kind of things. Remember, your capital is limited. You just want to start. If you start today, if you grow into the second store, if you grow into the third store, to go into the fourth store.
I want us to touch on the biggest policy or regulatory challenges that can impede growth, just very quickly. Anais.
Okay. Well, as you scale your business across multiple markets, for instance, in Nigeria, we're Nigerian, we're scaling across other African markets. You soon realize that regulation is not just about compliance, because there's no one size that fits all. You go to a new market, you have to learn about culture, you have to learn about policies, national priorities, change management, and all sorts of things. So, and innovation is always ahead of regulation. When we started off, there was no telemedicine policy. So we started our way back 2017, before COVID pandemic, and before telemedicine became sexy. And people were like, no, the clients will not use telemedicine. They like to go into the stores, into the hospital for doctors to touch them. Then, boom, COVID started, and there was no way people could access healthcare. Then people started saying, oh, that's what you've been talking about. And it's incredible to see that a few years down the line now is now at the forefront of digital, global health discourse. Everywhere in the world, Nigeria, everybody is talking about digital health adoption, how this can help to scale and to also defrag our healthcare barriers. So one of the regulatory challenges we faced was that there was no policy. And healthcare is one of the highly regulated sectors. And right so, we're dealing with patient lives, they're entrusting us with their care. So what we didn't let that deter us, right? We just went in and started. People were like, "Oh no, foreign doctors cannot do teleconsultation." Well, Nigeria is already spending over $2 billion on edible tourism, consulting with doctors like myself in the UK, in the US, everywhere else. So then we started, but what we did differently was to engage proactively. We're not seeing regulators as enemies. I think one of the mistakes people see is, oh, regulators, they're difficult. No, we took the proactive step to start to engage the Federal Ministry of Health, to start to engage the State Ministry of Health. We engaged the various stakeholders, NDCN, NMA, PCN, everyone that needed to be in the loop, MLCN, to say, look, digital health is coming and we need to be prepared. What should be the grade of the doctors providing teleconsultation? What should be the minimum qualification of whoever is providing teleconsultation? If you want nurses to provide teleconsultation because their CHUs are already providing some form of care in primary health center, can we define the limit of their professional liability? If there is going to be teleconsultation cross jurisdiction, where is the jurisdiction of choice when there is a medical legal issue? And I hear a lot of discussion we had earlier, people talking about clinical, how they are very careful. It's true, because it just takes one wrong case for the hammer to come down. So we didn't want that to happen. We started to engage very, very early on. We looked at global practices. What are the best global practices? But we're not going to cut and paste the solution from the West and bring it to Nigeria because it won't work. So we decided to adapt it for our local reality. And that data that we'll be talking about, we're able to, get enough evidence. Then we took it to the NHIE. We took it to the minister's office, and they gave us the backing. So last year, we organized the first National Telehealth Conference in Nigeria, bringing together regulators, private sector, the civil society to look at how do we scale telemedicine so that it becomes part of national health insurance benefit. A patient shouldn't need to pay out of pocket for teleconsultation again. So now we are at a point where the National Telemedicine Guideline is almost done. We are organizing the second edition of the National Telehealth Conference, October 20th. And with this, we believe that, again, pharmacies are going to be central to telehealth provision because 80% of Nigerians already come to pharmacy. What we want to do is to augment that, the access point. And also, we provide teleconsultation in rural hard-to-reach areas with satellites, with solar, with point-of-care diagnostics, and essential medicine within that facility. That way, we are able to reach the last mile with a trained operator. So what should be the regulation around it? The multitude of pilots that we have done enabled us to provide the data that is now going to be useful in scaling. Thank you.
How does Rigo come in for them?
Okay, thank you very much. So, like I said earlier, Rigo Microfinance Bank is a healthcare bank that provides financial solutions strictly for healthcare businesses. And what this means is that we are not just your regular banks. We understand the unique rhythm of the pharmacy practice. We know the nuances. We understand your cash conversion cycle. So when we are giving you credit facilities, we don't just focus on collaterals only. We actually look at your cash flow, like Dr. Christopher has mentioned, and we actually structure the finance that aligns specifically to in line with the structure of your pharmacy operation. So our booth is actually on the right once you enter the exhibition stand, where you can come in on board, discuss with us, and let's understand how we can fund your business strategically. Because also we believe that pharmacy businesses we are entering a very, very exciting phase in Nigeria right now. And for pharmacists, you have to build resilience. You have to have some things that are very important. Number one is that you have to ensure that there's data. You have to ensure that you the current technology, just like Dr. Funmi has earlier mentioned, and partnership is very important. And partnership with associations like the ACPN, or partnership with hospitals, with HMOs, with distributors, and with financial institutions like Rigo that understands the unique need of your businesses, because the future of pharmacy actually belongs to connected businesses, and it's businesses that actually partner with institutions that understands their nuances. The institution called the pharmacy business that would continue to grow over the next decade.